So the topic of today's webinar is effective communicative strategies in healthcare advocacy. And as I called it, it's empowering patient advocates for the International Gaucher Alliance. What gives me the right to be today's lecturer or moderator or even facilitator? I have a master's degree in sociology, and that was my main profession for up until 5 years ago. I was working in public utilities, in media, and in public relations. But we had an experience with rare pediatric cancer. Our younger boy had rare disease, and he was a patient. And then after 2 years and 3 sessions of chemotherapy, he was cured. But up until that moment, I didn't know that around 95% of rare diseases don't have a therapy, don't have cure, and Victor was in those 5%. And then the level of communication in between patients and healthcare professionals was my main motivation to get involved in the rare disease community. So besides that formal education, I went on a journey of informal education. So last but not least, I'm this year's member of Pataki cohort. It's an European training center for patient experts. Topics are research and development in clinical studies and health tech assessment. So developing medicines and including patients in clinical studies. And those patient experts are, I think, imagined as the bridge between patient and healthcare professionals and other stakeholders in this process. Before that, I finished winter school on scientific innovation and translational research. And a lot before that, I was a trainer in media by the National Democratic Institution. At this moment, my main job is development manager for specific genetic tests in one Serbian country, which is called Premium Genetics. And in all of that, one of the main hats that I hold on my head is that I'm a patient advocate in the field of rare and malignant diseases. Also, our experience gave me the material and inspiration to co-create with my husband podcast, which is called Rare and Share. It's mainly recorded in Serbia, in Novi Sad, since we live in Novi Sad. And our guests were first and foremost representatives of patient organizations advocating for rare disease patients. Also, among our guests, there were psychologists, doctors, representatives of pharma industry. We have around 20 episodes recorded and published, both on YouTube as a video podcast and in audio platforms such as Spotify, SoundCloud, Deezer, Google Podcasts, etc. And I'm currently living in Novi Sad in Serbia with my family. That's a family of 4 members. Beside my husband and me, we have 2 boys. And at the end, I think they are the main motivation to talk and to communicate with all the stakeholders included in the process of diagnostics, of treatment, and in the quality of life of patients with the rare diseases. So before I continue my presentation, I would like to hear more from you. Since we have a small group, if anyone of you is comfortable to introduce themselves and to share with others what is their motivation to be included in the patient advocacy.
Nobody's raising a hand. No, Alejandra, we don't have translation in Spanish. Alejandra, no tenemos traducción en español por hoy. Para mañana, sí, para nuestra reunión en la mañana. Nobody wants to say anything. Okay.
I can start.
Tanya, Michaela, and Tanya.
Sorry. Tanya, if you want to go first.
No,
it's
Michaela,
okay.
you go first.
Hi, everybody. I am Michaela Dan, and most all of you, I think you know me. I'm originally from Romania. My grandmother was born in Novi Sad. It's a small world. I'm living in France now. I'm a patient with Gaucher disease type 1, and my sister has the disease too. So at the very beginning, about 25 years ago, that was the motivation. I had some knowledge since I was a student in medicine at that time. So I searched how to get treatment in Romania. It was a very long time ago. My motivation now is rather than that I know that there are many needs in the field of Gaucher disease, especially in Romania, but in France too. And I am a little bit trained now since some years. So I that's why I'm activating. What interests me is especially how to involve other people. As Vesna said, we are a small group, almost always the same. I participated to many trainings about how to engage with others, how to let others be involved in activities, and still the engagement is poor. We are always the same 2 or 3 people in little organizations to do things. So that's all about me. Thank you.
Thank you, Michaela. I think the consistency is the key in communication, in lobbying, in advocating. So this is a never-ending job. Okay, Tanya.
Yeah, hi. Like Michaela, I think everybody on the call knows me apart from you, Anna. So I am a caregiver. I have a daughter with type 3 Gaucher's disease, and I live in the UK. And my daughter was diagnosed when she was 17 months old. And really, apart from the first 6 to 12 months when I was trying to make sense of everything, I have been a patient advocate, first of all in the UK, then Europe, and now globally. And I became involved in patient advocacy really because I was thrown into this world of rare diseases. I didn't know anything about it. There was a lack of information. And I felt that if I felt like that, then there were probably a lot of other people that felt the same. And I wanted to build a community, which I think over the last 27 years I've done. I continue to now work globally. And the reason that I've continued to work despite my daughter doing really well and now being independent is that I see how much change you can make if you work together collaboratively, and if you empower other people, hopefully then they will take that knowledge and experience and make changes in their own community. As Michaela said, it's hard. You have to be very passionate to work in rare diseases. It can be very lonely. But we can see from the work that the IGA are doing at the moment, particularly in places like Africa, that when you empower people, you can make real change. Thank you.
Thank you, and I agree with you. I had the feeling of being in a cave, in a dark of lack of knowledge, lack of information, and that road was never ending, you know, because if you don't have the right information, you don't know what to ask, how to empower yourself to be a real advocate for your child as a parent, and then when you sum up the needs, and even in the best way scenario, if you find a cure and your child is treated, you give that strength to other people who are in a similar or same situation as you were in previous period of time. Biljana?
Hi, I'm Biljana from Serbia, and I have Gaucher disease. So when I was diagnosed in 2008, I did not have treatment, and it seemed impossible for me that the government will pay for my treatment. So that was my motivation in the beginning, but not in the beginning. I started to work in 2014 because I realized that I have to do something. And now I have a treatment that I chose. So it's not only that the government pays for treatment, but we can choose one. And also I feel, as I'm president of Serbian Association, I feel like in charge for my people. If someone misses treatment or something bad happens, I immediately stop all other activities and try to help them. Because I think it is important that we are all safe. And also I'm chair of International Gaucher Alliance. As EGA, then now IGA, helped me in my journey to treatment. I feel that it is my obligation to continue this work and to help others.
Great, thank you, Biljana. It's a pleasure to see you even this way online. One of the guests in our podcast was a father of a boy with Gaucher, gospodin Mr. Davor Duboka. His son Boris had a problem, at least taking the medicine, because it wasn't available in Serbia at that moment. And now Davor is in other structures, but it was a great pleasure to call him and invite him to be one of our guests, and their story is also shared in the podcast Rare and Share. Does anyone else wants to mention anything, or can I continue with my presentation? Okay. So, besides the introduction, I would like to introduce you today's agenda. So, which are the key techniques to enhance advocacy efforts? So you can communicate with the stakeholders or institutions based on building relationships with the institutions and other stakeholders. Also, which are the main strategies for building coalitions, and how to improve with these key techniques and tools advocacy for the members of your community and other patients of rare diseases. So Vesna already mentioned, and I know you are well versed in communication, but I would like to remind you on those two topics which were covered last year, just as a reminder. So how to communicate and how to build a strong story which can be used in raising awareness about specific rare disease, in this case like Gaucher or any rare disease, how to use visuals, illustrations, your stories, how to bring up the emotion from the wider society and wider public who can be interested in getting involved in your communicating or advocating. And every message should be closed and finished with clear call to action, whether it's share this post or share this announcement or share this news with us or with your connections and your followers, or invite them to some specific gathering or occasion or any important date in the calendar. Also, as patient advocates, we are all public figures, so we are representing the community. Since Biljana already mentioned, she's a chairman and she's the president, so she is bringing the essence and the emotions of the whole community. And then that's also one of the continuous jobs we have, improving and developing effective communication skills. That's why I'm always in the training and in practicing my public appearance skills. Also, media engagement. I know, and I would like to hear your opinion about this topic, that the last day of February is mainly the date when media calls us. And it is our job to be, I should say, attractive, but to have news for media throughout whole year. So whether it's some campaign or some event or some, I don't know, maybe media appearance or some international conference should be delivered to media as a news, and then communicate it as try to have friends and associates through in between the journalists so they can share your news. So about communicating and storytelling, just one slide, just as a reminder. And I would like to see and hear more from you, which is the level of your public speaking, or are you interested in improving skills in communicating from now on? Do you have any problem in communicating with the wider audience or medias in your countries? If that's not the case, I will continue with the presentation. So about today's topic, there is advocacy techniques and tools. And these are some of the suggestions. Okay. These are some of the suggestions where we can use them to build up patient advocacy and to try to empower patients to be as relevant as they can in communicating with the stakeholders and decision makers. So one of the tools I would like to suggest to you, we were using them, was the lobbying aimed at the decision makers. In Serbia, we have really stable and long history of lobbying throughout changing the laws and bills, lower mechanisms of local municipalities, changing the practice of the healthcare institutions, so the patients could have a higher level and more qualitative, higher level of quality of life. So grassroots organizing and social media advocating or advocacy, grassroots organizing and I don't know, fundraising events were one of the main strategies of rare disease community in Serbia, gathering the money for buying, I don't know, like wheelchairs or specific medicines or food, which are meant for the patients with the diagnosis of rare diseases. And in between that, there is social media advocacy, because people are nowadays more visual and they like to see and share, giving that their part of the engagement. And then every action was followed by the posts on Instagram, on Facebook, in LinkedIn as social media for professionals. But what were the aims and goals of those actions? First and foremost, they were policy changes, increased research funding, and improved access to treatments and services. So from 2016 up until these days, we have a large elevating of public notion about spinal muscular atrophy. Since in 2016, there was one clinical study and Serbia declined it. But from September of 2023, every newborn baby is screened for SMA as PKU or phenylketonuria, congenital hypothyroidosis, and cystic fibrosis. So we now have 4 diseases which are in a newborn screening for all babies in Serbia. What's your experience with the newborn screening?
I'll tell you, I had troubles in Macedonia. We didn't have phenylketonuria screening until this year, which finally got it, and it was a great success. But before we did have the others that you mentioned, and for the spinal muscular atrophy, they started last year. And they're already finding it. You know, it's amazing to see that you can make such a big change just with newborn screening, because you are going to get normal life to some people. This is what matters. It's amazing. We don't still have it for Gaucher in many countries, but maybe one day that will be something that can happen easily too. Let me see if anyone else is raising a hand.
Okay.
No, but Jasenka is writing that in Croatia they screen 10. Yeah.
Thank you, Jasenka and Christian. I understand why you are writing and not participating in the webinar. It's okay. And in Croatia, there are already 10 diseases. And that's a great thing, because Italy was lobbying for around 40 years, and they have around 40 diseases. I know that the cost efficiency is one of the main reasons, because if you have a screening, then you need to have medicine or cure for the disease. But sometimes for the parents of newborn babies, it's easier, and it's already halfway there if you know the name of their enemy, which is the disease, and how to tackle with the information. So in Serbia, we have around 8 years of lobbying and advocating for widening the list of diseases up from 2016 and that clinical study until September 2023, and we now have 4. There are some announcements, but they are not for now, they are not public, that we will continue to widen the list of diseases, just because in the early development, it's easier to tackle those challenges, and when the progression of the disease began, you are running out of time, and therefore many of these diseases are not covered in the healthcare insurance, and that's why those research funding and improved access to treatment and services is important. So for the next slide is one of the main topics I would like to talk with you. That is building the relationships and coalitions, because curing and treating a rare disease is not one-dimensional problem. You, I think, are the best examples how much effort is needed on a daily basis to tackle these challenges. So you need to learn the importance of building relationships in between volunteers, policymakers, healthcare professionals, and other stakeholders. If we are talking about education, kindergarten, inclusion of the patients with rare diseases, and trying to communicate every day with all of them in every dimension of life. Also, we need to learn and to collaborate with other advocacy organizations and patient groups, so we have a collective voice and achieve common goals. And here I will stop, and I can offer a few examples which were main topic for media and stakeholders last winter, since we have a national organization for rare diseases, and it's an umbrella organization gathering all rare disease organizations. So in our assembly, we have a few dozen of members, and last December was the first invitation for the members of political party to involve in dialogue, where we were asked to, talk about our problems and our needs, and then that will be main topic of pre-election campaign. And then at the end of the year and in the beginning of 2024 were the first meetings with the President of Republic of Serbia, with the First Lady, with the ministers of 3 ministries about demography, or we called it Briga o porodici, but it's family issues. And then there were our national fund, insurance fund, who is dividing and paying all the medicines and treatments for the patients with the rare diseases. So when we are talking about right tools in building those coalitions and empowering patient advocates, these are some of the suggestions. How can it be done, and how you can use those tools and mechanisms to talk with the public figures, with decision makers. There's always the ethical advocacy practice as a question, and then, and engaging patient advocates and volunteers can be a everyday job of building and maintaining the credibility and trust. You can be a part of the solution and not only the problem, and you can be an ally to the stakeholders, healthcare professionals, decision makers, or policy makers, since we had experience in Serbia, where we participated in the meetings with the Ministry of Health and talking about practice of ensuring that all patients get their medicine. We have a practice of off-label therapies, which is based on the, I think, on the asking from the healthcare professionals for their patients, and then National Security Fund will pay or refund that amount of money. Sorry, I'm clicking on the presentation. Don't mind me. So here in the section of measuring impact and outcomes, I would like to hear from you more about those 3 thoughts or 3 sentences about clear objectives and goals which you would like to work in developing strategy and measuring the impact of your advocacy. Is it possible to do it right now? You don't need to write them down. We can speak about them.
Yeah, Michaela wrote it down. No, it's not about the goal, but we had some messages from Alexandra and from Michaela. And okay, so well, I'm focused on getting decentralization of medicines and health services in North Macedonia, because not just for rare diseases, but for all chronic diseases, people need to travel to the main capital of the country. And I hate that. And it's, you have to take days of work, it's travel, it's torture, it's financial burden, a lot of things. I mean, we did the research with the families because they said that the institution said that we don't have the research. So maybe this is an example that helps out in advocacy. When you go out with the problem, you need to have the research behind it to say, okay, we made, focus groups, we did a survey, and these are the results. 80% of the people responded that traveling is a huge burden on them for treatment, for control, for whatever. And now we are trying to change this and to get decentralization. So I'm going to focus on this and on maybe a little bit on an early diagnosis, but they're both connected, because working with primary health will get me more support from primary doctors to do the centralization.
Yes. And we have a few referral institutions, like an institute in Belgrade and one place in Novi Sad, which are dealing with the same patients, but on other locations, so they don't travel and lose those days traveling and finding the terms and dates for the meetings with the healthcare professionals. I'm reading your comments, and I agree with them. First of all, Alexandra wrote that the motivation for raising awareness is she can help and guide others to learn about the disease, spread the word to others, the disease which is rare, and it has a treatment and can have a quality of life which allows you to develop as a person. And that is the minority of diagnosis in the rare disease world. And then there are different people with various, diagnoses of lysosomal diseases, including Gaucher. Also, currently, social networks are great support, even if you don't have experience in managing digital media. I agree with that, because that's the main window of the organization. There you can show what you can, who do you engage, and how many members of your community and your organization there are. And sometimes it doesn't need to have a face, but one number or messenger or place when you can ask the questions you are dealing with. It brings a lot of security. And Michaela also wrote that working with bigger organization gives a good voice or visibility to small associations, helps making connections, and is as an opportunity to push things it's right. Therefore, we have on our side in Serbia NORBS as a national organization, even NURDOR, which is National Society of Parents of Pediatric Malignant Diseases. So I was a member of, I was maybe not a member, but someone who asked for help. So I was a client of NURDOR before I became a member of NORBS, because they had small gathering and like safety net for those who are actually dealing with the disease, with a lack of information and lack of possibility to do anything. So the support and communication is I think already a big deal. And then at the end, yes, from digital spaces you can reach places where there is an internet connection. Even technology communicating in other languages should not be a communication barrier. That's true also. And that's why our job is never ending, because we need to communicate every day, even if it's good, if it's bad, if it's small, if it's big, we need to communicate. And some of the messages, you don't know where they are going to end, on which part of the globe. So by the end of this training, our goal is to have a comprehensive understanding of rare diseases advocacy and communications, and to give you suggestion of some practical skills and tools which are needed to advocate effectively for yourself as a patient or your communities as a chairman, as a leader. And on this picture, do you see the picture on the right side of the screen? There is Bojana Mirosavljevic. I think she is a bright example in Serbia of parents losing their child from Batten disease, but that didn't stop her, because she created an organization called LIFE, tackling and fighting against all rare diseases, and creating rare diseases database, which was in 6 countries, translated into 2 languages other than Serbian. So the rare disease database translated around 6,000 diagnoses in Serbian, in English, and I think in Macedonian. And she is, for the 5th time this year, organizing Rare Diseases Database Conference. It's a regional conference. It will be held in November this year. So she is advocating for all children and all patients. She was one of the members who created NORBS, or National Organization for Rare Diseases. And she's still really involved in the community and in finding the way to answer all the questions and improving life of patients with rare diseases. So if you haven't written your 3 sentences or you have an idea, please share them in the comments and we can talk about it more later. Just to find the next slide. Yes, here are some real-life examples from Serbia. So it's a continuous job, and we were speaking with the policymakers about all relevant topics, openly, transparently, trying to find solution which is the best for all stakeholders in this in this process. And therefore, I was planning to show you these two examples from partnership between patient advocacy groups and government health agencies in the goal of improving access to healthcare services. On the left side of the screen, there is a conference about registry for rare diseases. So what Bojana done was projectly funded, so it's her project, and on the state level we still don't have a register. We don't have precise number of patients. We don't have cumulative number of diseases. We are only guessing. So talking about in between 6 and 8% is around 500,000 of citizens of Serbia. And in this register, we have, I think, 5,000. So something isn't right. And then you have here on the left side of the screen a photo of Ministry of Health, National Security Fund, or Healthcare Security, professors, genetics, and there is no one from the Ministry of Finances, since they have the money and we asked for that money. They haven't agreed to participate in this conference. That was, I think, October or November of 2022. And on the right side of the screen, it's a conference for media in Belgrade, organized by a civil society organization called Children of Achondroplasia, mainly organized by parents of children with this diagnosis, since up until 2 years there wasn't a treatment. And then one of the pharmacology companies had genetics therapy, and they offered it as a donation. And then after that donation, our policymakers and our politicians needed to make a decision to continue financing the therapy for the children with achondroplasia. So we gathered on a media conference representatives of Ministry of Health. There was Professor Skodric, who is a director of the National Fund, Social Fund, and representatives of the organization. So in 2 years, from the first information, there is a therapy available for the patients, up until making it possible for all patients with this diagnosis. It lasted only for 2 years, and they used all the tools. So media appearances, lobbying, negotiating, making events for the children, making them visible, and alarming the wider society that the cure is close, but we need to find the way and mechanism to make it possible. So that's one of the things I think we are all proud of, since it was everyday communicating and continuous work in raising awareness and talking about the topics which can be changed for the better quality of life of the patients. How was your experience in North Macedonia about bringing the decision makers in the dialogue?
Decision makers are never easy, but I think that when you get enough media attention, then you get the intention of the decision makers, of the institution representatives, because they don't want to be seen as the bad guys. They want to be seen as the good guys. So now after many years, I don't have a problem getting a meeting with a new minister because he knows he has to meet with me and with some other patient advocates in Macedonia, and it's somehow easier, but it's still a challenge because you go there with a lot of requests and you say, you are aware that they want something short term because they want to be seen in the media like they're doing something right in the first days of their, becoming a minister or what, or a director of a hospital. So we usually choose something small to begin with and say, okay, we are starting with this. We are going to make a fuss in the media, but then you have to announce the plan for for the next 3 years too, because we don't want just something to happen now and then to be forgotten about everything else that needs to happen.
Yes, yes, and I agree. And therefore, we have a social media. In making the fuss, they can be really useful and resourceful, since they are the window of our shop or our organization or the topic which is really important to us. I myself had an experience with the Ministry of Health and Ministry of Finances. In 2020, I used the Institute of the Request for the Public Information. In Serbia, we called it Informacija od javnog značaja. I don't know how to translate it in word. So I asked, how many of patients with phenylketonuria there is in Serbia? So all age groups, both genders, how many of patients there are, and they have the obligations to answer in 15 days. So one of the state secretaries of Ministry of Health wrote in his answer that he doesn't have the information. Ministry of Finance doesn't have the information because it's specific amount of money which is divided and spent in hospitals, and only the fund gave us the answer of the sum of the total amount meant for the medicine food or specific food. Since in PKU in Serbia there isn't a cure, they just have dietetic regime with lack of proteins. So as stakeholders, as public institutions, they don't have precise information. And then we learned that only the doctors have the information since they are treating them, but doctors do not want to share the information because of the private data of their patients. And then after that, we sat at the same time on the same table and talked about possibilities of improving the quality of life of how many patients there are. But we use the mechanisms and tools to ask for transparent communication and trying to offer some suggestions as a resolution, not as a problem. So I know they want to deal with as small problem as they can tackle, and then not the big ones, the large ones, the long ones. So it's your power to communicate it throughout the social media, raising awareness and using your experience and knowledge to offer solutions when they don't see it. Okay, here is one more example in Serbia, in Novi Sad, and as I already mentioned, this problem or this example is dealing with changing the practices. So there is a situation in Serbia, in Novi Sad locally, to be more precise, where the kindergarten is taking children, and we are talking about inclusion, diversification, dialogue, and etc. But there is a group of children with neurotransmitter diseases, and so for them to function normally, they need to drink their therapy. So it's a tablet, and it needs to be taken orally. And they need, at a specific time of day, they need to drink their medicine. And we analyzed, Vesna already mentioned, we did the research, and we pointed out the main problems in the practice of this institution, and told them which are the things that can be changed without any money invested. They don't need any more money to be invested, just to organize better, so the children with neurotransmitter diseases can be enrolled in the preschool institutions. And then throughout the meetings with the decision makers in the city and the responsible persons in the preschool institution, we came up to agreement to gather the medical nurses, so they can have the control of few objects, and then trying to take care of the patients, since they need to be socialized and involved in the community of their peers. After that, we also created the focus groups from the parents to hear their experience, to see what are they gaining, how much time do they have to work on their jobs, and is it improving the quality of life as a preparation for school. Project was called Improving the Mechanism of Healthcare for Children with Rare Neurotransmitter Diseases, Developmental Difficulties, and Chronic Diseases. So it was a wider topic than strictly rare diseases, but it was one of the projects I was included, and it was based on dialogue, and all the other activities which were included in this project. It's still ongoing question, since every year the preschool institution is, I think they are not committed to taking responsibilities, and parents are, I think, pretty much scared to be in an open conflict with the kindergarten teachers or nurses. Just a second. And so these are, sorry, one slide for up until the last one. Which are the strategies for building those coalitions? Here are some of the suggestions, and we can talk about any of them, or each of them, or all of them in conclusion. But I think main goal in the National Organization for Rare Diseases was to try to improve the quality of life of all patients, whether they have one or other diagnosis. Establish trust through transparency and collaboration, insisting on communication, and trying to be open, trying to be available, and trying to be a part of the solution and not part of the problem. Also, engage in regular communication and feedback loops. We had occasions and possibility to speak with the policymakers. We used that possibility to aim at the problems which are constant and continuous, and only small amount of patient representatives and patient advocates weren't at these meetings, since we all know the political situation in Serbia. And then anyone who could thought that they don't need to talk to our main party is already at the margin of social sense and social, I know, maybe any idea of dealing with this problem can be solved only throughout those meetings, and then anything else must to wait for another time. Also, we can be connected, I know, regionally, and try to diverse and transfer experience and knowledge from Serbia to North Macedonia and vice versa, because those coalition building initiatives are not strange and not different. Problems are, I think, the same in the whole region. I don't hear that the problems are different anywhere else, and therefore I think the communication first and foremost must be transparent. Do you have anything to add? Do you think something might have a better results besides these strategies? Yes, Vesna wrote that sometimes you need to change things locally, and that's one of the examples, as I already mentioned. In Novi Sad, we started with one municipality. We talked about inclusion of children with rare diseases, and then it was a wider topic with the children with diabetes and other chronic illness. And it was concerning all country, all the Serbia. And last but not least, instead of conclusion, I would like to share with you more photos and examples of building coalitions between patients, patient representatives or patient advocates, and policymakers or decision makers, since these dialogues and meetings had resulted in a few possibilities of types of help that patients can use. One is like a voucher. It was money for the patients in one-time amount of around 200 euros. Also, rehabilitation in spa places, and the third options is voucher for the supplements for the patients. So I don't have a better advice than to insist on effective communication, which is essential for successful advocacy efforts. And then you can, as you already mentioned, and I know that was your experience from last year, you can craft elevator pitches and drive a meaningful change in healthcare in your own community for start, in your local municipality, and then on the wider scene, even internationally. And as I already mentioned a few times, I'm always looking for the ways to be a part of solution, to suggest something which you can do and you can relate to, and not the part of the problem. I think that's driving them around, and then they are, I don't know, hiding or don't want to see with the patient advocates or patient representatives. They don't want to talk about changing the things which can last longer than their mandate. And then all of us are already offering some time and energy, and we can offer them as an allies to be partners, and they can in that way rely on us. So I would like to hear more from you and your experience. What is what you want to improve your skills on, and how can we help? These are my contacts, and I would like to open a Q&A session, as it's called, but some of your comments are already valued, and I would like to cherish them, as I may say that. Do you have any question for me? Michaela?
We have a quiet group, but we have Michaela.
Yes. Sorry, I will stay with my camera shut down. Did you met physicians or medical teams not willing to work with your association, having a more paternalistic attitude that they are already doing, which is for the good of the patient? And how did you deal with, how can we deal with such situation?
I understand your question. We have a very specific situation in filling up the registry of patients with rare diseases. No one knows what to do. And then Vesna already mentioned she was eager to talk with primary healthcare professionals like chosen doctors, and these kind of reports and work needs to be done by secondary healthcare professionals or in tertial, third right institutions, and they were very, very defensive at the first time. So they have enough of their job, they have to treat patients, they don't have the time to enter any data from their patients just so they can have the certain amount of money and other ways of help. And that was one of the main problems and one of the obstacles for continuing our communications. But on the other hand, we had support from the policymakers, and we used that help and support, reminding them that it's also their job to insert and input data about their patients. So we have as precise registry as we can. So I know that as a patient, as a parent of a patient, there is a certain sense of fear or, I know, hesitation for communicating with doctors, but they're all people also, and they sometimes maybe don't want to, but other times they will communicate with you and trying to help you in best way there is. I had problem personally with the doctors who didn't want to give the information about patients from PKU, but I insisted on communicating, and we tried and successfully found out how many patients there are, but it wasn't because of them, but because of other sources of information. And that didn't stop me, because they once said no, they are obligated to treat their patients and communicate as a responsible healthcare professionals. Any other questions? Okay. I have prepared one questionnaire. It can be anonymous if you don't want to share your name or surname, but I would like to hear from you as a feedback. Was it useful for you? And will you use it? I will send to Vesna the presentation. I will send all my contacts. If you want to continue the communications about patient advocacy, about the podcast Rare and Share, I will send all the links. And I hope, don't be a stranger, say hello, write the email or find me on the social media. I'm really active and I'm eager to see and hear other people's experience. I remember the first information and first news we heard about Victor's disease and how lonely I felt. And then nowadays, when someone calls and asks me about help and information, I always tell them I'm not a doctor. I don't have a medical background or education. But if you want shoulder for crying, someone to talk to, even someone to snuggle some alcohol in the hospital while the children are sleeping, I can do that. And I will always be there for those who need few minutes of talk and maybe some information they didn't know before that.